Well, I was diagnosed in 2004 with retinitis pigmentosa, but really didn't have any real deficits in terms of my vision. I could still navigate. I worked full time as a nurse. But then, unfortunately, in 2011, there was suddenly a rapid decline in my central vision. And I noticed that when I was actually at work trying to, in the morning, drop some insulin for a patient and realized I couldn't see the syringe, couldn't see the gauges. And I really panicked thinking, what was happening to my eyes. I wasn't really even thinking about it being RP. I thought it was something, medically going wrong. So I had like CAT scans done and MRIs and nothing was showing up. So then I was referred to some eye specialists downtown who in turn then finally said, I believe that the retinitis pigmentosa is progressing and unfortunately you will no longer be able to drive. There's no treatments for this, so just prepare yourself, get your finances and everything in order, look over everything, and be prepared that you're going to lose your sight. And in terms of my job as well, I was gone onto disability, which in turn became permanent. And in the interim, I had a child that was 1 year old, and then when I went off on disability, she was 9. So it's been a real struggle financially. It's been a struggle getting my head around the fact that there's no cure. But as a nurse, I've always been one, because I'd seen a lot of miracles, or they call them miracles at work, with my stroke patients, with my cardiac patients. And I always realized that it was the frame of mind in terms of how illnesses actually had outcomes for a lot of them. I know it's not always a guarantee, but it just seemed to be something that patients that had more of an openness to possibilities of improvement, and or okay, if a certain treatment didn't work, there might be something else down the road. So I sort of started to think that should be the same for me. I should be learning from what I've learned from my patients and living that way. So I kept thinking there's some stone that's still not unturned here. And I know that conventional medicine wasn't offering me anything, but I started to look in the internet and learned more and more about acupuncture. Now, and through my life, I have dealt with naturopathic medicine and combined it with conventional, and I've seen it with some of my patients as well and had excellent outcomes. So I researched that there was someone actually that was doing it in the States, and I began about 4 years on this journey of acupuncture, and I would do 10 sessions through a 5-day period. And the first year I did that 3 times a year, and it was a little bit costly. So then I just did it annually. And then that became too costly as well. So I thought there must be maybe someone else in Canada. I kept researching through the internet. It's got to be somebody. And lo and behold, Ryan's name came up. And I was very excited because it's really close to home. And he practiced through Andy, and I thought that's even more of a bonus because I'd had some good outcomes down in the States. After I'd finished my weekly program, I could see that the fogginess of living with RP, a lot of you will know, is sort of like you're in a haze depending on lighting or depending on what the weather is like. And the haze by the end of the week would lift for me. I wasn't able to read anymore, but I could see that there were things on walls. I could see that there were plaques and there were outlines. And so that was exciting. I always thought there is some positiveness in terms of this acupuncture improving your innervation, improving circulation. And I'm totally for that because I saw that with my cardiac patients. I saw that with my stroke patients, looking at their results from MRIs or echocardiograms, and there was an area that was always protected. Our bodies are incredible. Like they protect themselves whenever there's an injury, so that they're trying to salvage whatever cells were still functioning, and they go to sleep. And I saw that. So I truly believe that with my eyesight problem, there must be part of the eye which is protecting itself. And then acupuncture is really stimulating in a positive sense in creating the blood flow again and in creating innervation. So it's almost like tapping your cells and going, hey, guess what? Something's good coming down the path here. Let's wake up and see what you can still do as a functioning cell. So when I go into acupuncture, I kind of sit there and I do my own meditation, whether it's meditation or not, but I start talking to the cells in my head and going, okay, this is your time. Get excited. It's like you're going to an aerobic session. Get moving, get shaken, and more of this acupuncture sensation will get to you and start to heal, in terms of the outside surface, and then kind of get inside the cell. So I've had great outcome. About 2 weeks ago, I went to see my doctor downtown, and there's an OCT test that really checks out the fluid. I've had troubles all along with edema in my eye, especially my left eye, since I was diagnosed. And every time I'd go for these tests, they'd say, oh, it's getting worse, it's getting worse. And then about 6 months ago, I was told my right eye was getting the fluid. And that was very hard on me, because I thought, we all know with fluid, it impedes circulation, impedes innervation getting to cells. And I thought, it's not a good sign. It's going to just keep progressing fast. And then got this OCT test done, and it shows that the fluid actually has diminished, including in the left eye. And I've never in 4 years been told that. So I'm kind of riding a good high right now, and I truly think that this acupuncture session that I'm doing, now it's twice a month, I think it's a positive. And I'm going to continue on. And I'm keeping my own journal. I think it's very important for us patients as RPs to sort of set out our own journeys. There's nothing charted out there for us. There's nothing conclusive. But I think if we just keep our own journals and, also document what's happening on a day-to-day, professionally, nutritionally, health-wise, your family circuit, your friends, because we all take in other people's energies, negative and positive. And although it may seem insignificant when you're writing it down, or as I do talking to a mic, I think down the road something's going to come together and it's going to just jump out at us, and it's like, wow, it's because of these factors that impede on your success or not in terms of outcome. So I truly believe that my journey is to prove to whoever out there that acupuncture is so important, that's going to piggyback to the stem cell research, to gene therapy, because I think if we've got a healthy bed of cells waiting for the next course of treatment, the outcome is going to be more positive for them. And I can sort of see some literature out there sort of swaying and not stating that it's acupuncture per se that it's going to help, but there's, improving the bed cell and cell function for the outcome, the ultimate outcome.